Hello, everyone, and welcome to another episode of Equilibrium. I'm your host, Bria, and today we're here with a familiar face. Dr. Stephanie Hack is a board certified OBGYN and host of the Lady Parts Doctor podcast. Thank you for being here.
You're welcome. Hello.
So excited to see you again. Our last conversation was about abortion and just all of that stuff that was going on last year and access to it. And I love that episode. Thank you for doing it. And I'm excited to talk to you today about at-home births.
Yes.
Hot topic right now.
Topic.
Yeah. So what fascinated you about this topic? Let's figure that out.
Oh, what fascinated me is the controversy. It's controversial. As an OBGYN, I see it as something that more and more women and birthing people are desiring. And I see a lot more celebrities talking about their experiences with home birth or desiring a home birth. I've had more patients talking about having a home birth. But I would say for many OBGYNs, at least the ones that are part of my community, we hear home birth and we're like, no. And, present company included. I'm not so much like no as much as I'm like, are you sure?
Yeah.
But at that same time, you want to respect the decisions that your patients make. And we recognize that our patients have autonomy, as they should, over their bodies, over their births, and over the decisions that they make with their healthcare. So what brought me into it is I just wanted to know more. I wanted to speak with people who were more into the home birth process and who knew more about it than I do. So I recently, during Black Maternal Health Week, just last week, I had a conversation on my podcast with an OBGYN who is also a postpartum and birth doula. And we talked about her experience with home birth. And it was really enlightening. It was transformative. It was just a great conversation, which I think I left feeling more like, okay, home birth is something that I'm going to include in the conversation with my patients.
Interesting. Yeah, it's funny that you mentioned the sort of hesitation to do home births because I'll see it on TV or like hear about it, and I'm like, that sounds a little dangerous, a little scary. Can you tell us, from start to finish, like what is a home birth? Like what happens?
Sure. I mean, I am going to be pretty succinct in my explanation, but in a situation where typically you would call the hospital call line and say, hey, I'm having my contractions this often, this far apart, so on and so forth. Instead, you would call your doula or midwife. Your midwife, depending on who is going to be at home with you, it is different what sometimes people do and what's recommended that people do in a home birth. But for recommended, let's say you call your doula or your midwife and they're working together so that they can say, okay, at this point, this is when, we will come in to assist, or your doula may come right at that moment because that's your birth support person, but your midwife will come and assist when you're in the labor process, and all of the things that would typically well, not all of the things, but your midwife would come and be with you while you're laboring and would ultimately assist with the birth of your baby. Just as if you were in the hospital, your midwife would be there while you're laboring and assist with the birth of your baby, or your physician, depending on who is your provider, your healthcare provider for your pregnancy and your birth. And then instead of going to the postpartum room for recovery and so on and so forth, you'd be at home and you'd recover at home. And you would only need to go into the hospital if there were some kind of complication for you or the baby. And that's it. I'm being very succinct.
Okay. So a midwife would come to you, or you would use a midwife in a hospital as well.
You can.
Okay.
Yes.
You can have all, like a doula and a midwife, all of those people could come with you in a hospital as well.
Exactly. So, at my last my last practice, where I was full-time, we either took on the prenatal care of our patients, or sometimes our patients wanted midwifery care. And so we'd refer them and they would see the midwife. And then there was always a midwife or a doctor at the hospital. And the midwife would take over the whole process unless the patient needed it, until, let's say, the patient needed a C-section, in which case we would come and do the C-section, or they would continue the care of the patient during the labor and birthing process. And if they developed a complication like preeclampsia, severe preeclampsia, for example, that was out of the wheelhouse of our midwives, then we would step in and manage that condition, but they would continue to get the care from the midwife for the birthing process, because we really understand that people want what they want. If you want to have your care with the midwife a certain way, understanding that you'll have care provided a certain way, then that's what you should have. And if you want it to be a doctor for whatever reason, that's what you should have. So yeah, you can have, and the doula can come in either scenario. They're your extra support person. So they will be wherever you are.
It's sad to see the sort of statistics around pregnant Black women, especially, dying through and after childbirth, during childbirth. Is home birth an advantage that, Black women or Black future mothers kind of select? Is that an option for them?
It's an option for many people, and it's one that we don't offer enough. As far as when people say, or women, or birthing people say, I'm pregnant, the conversation from at least the OBGYN standpoint isn't, so where would you like to deliver, or where would you like to birth your baby?
Yeah.
Because we are not in that habit. That is not a general practice. Our general idea is, okay, which hospital do you want to deliver in? That's what we would ask. So it's a different mindset. Now, with that said, it could be a benefit. It's the issue with maternal mortality and the increased rates of maternal mortality in women and birthing people of color is complicated. And we know that racism is complicated. It's significant. It is the social determinants of health. It is the fact that certain communities may have more medical conditions are at a higher risk of developing certain things because of their exposures and what they haven't obtained, and poor general health outcomes for people who are not as served. We have the underserved and the served, for people who aren't as served in healthcare. But the implicit bias, the racism that abounds in society as well as within the healthcare system, affects Black women and people of color and birthing people in general. So one thing that home birth does allow that's different is the ability to select your birthing team. And if you have a completely uncomplicated process and you don't need to go into the hospital, then you are getting care from the people that you trust the entire time. And you are not necessarily in a situation where you're wondering, did they provide the standard of care? Was I treated a certain way because of this? That is something that your home birth experience offers. And it's not to say that a hospital birth cannot provide a similar experience, but in the hospital, especially as OBGYNs, fewer people are in solo practice where you go see your doctor and you're in labor and your doctor comes into the hospital to assist you in your birth. Like, that just doesn't happen as much anymore because people would work all the time like that. So often we're in shifts and we're taking calls, and it might be that you love Dr. A. Dr. A is great. You have a trusted relationship with Dr. A. You feel seen and heard and cared for by Dr. A. But then you go into labor and Dr. B is there. And maybe you have a different experience with Dr. B. Well, with home birth, depending on what the call situation is on your midwifery team, that situation is going to be different.
Right.
So in that way, yes, it can be a benefit, but again, you have to be the right candidate for a home birth, and home birth is not an option that is the best option for everybody.
Why my voice is so raspy, but I like it. Now you say you have to be a good candidate for home birth. Can
Yes.
you talk about what it, means to be a good candidate for that?
Sure. So the American College of Obstetricians and Gynecologists lays out very explicit, like, if you this, that, you should not do a home birth. It is contraindicated. So, for example, I would not have been a good candidate for home birth because I've had a previous C-section. I have 3 children, but and I've had 2 vaginal deliveries or vaginal births, but my very first birth was a cesarean birth. And the reason for that is there is a risk of uterine rupture. It's less than 1%, right? But there's a risk there. And in the event that your uterus ruptures, meaning that scar from your previous C-section breaks open, that can be catastrophic for your baby. That can be catastrophic for you because you would be bleeding a lot internally and your baby would lose your baby's blood supply. So we like you if you are laboring with that that scar, that cesarean scar, to be in the hospital, so that in the event that something like that happens, you are very close to an operating room to have an emergency cesarean delivery. Do people labor at home with cesarean scars? Yes, but
Oh,
it's
okay.
not recommended.
Okay.
Another scenario is multiple deliveries, or I have my little list to make sure that I'm covering them all. But when you have multiple births, so twins or more, it's contraindicated per the American College of Obstetricians and Gynecologists. We don't recommend that. And then fetal malpresentation, meaning your baby is not head down the way we expect the baby to be head down at the time of labor, then it's also recommended to deliver in the hospital and not at home, or birth your baby in the hospital, not at home.
Okay. So all these things sound so scary.
And there are some other things, like if you have severe preeclampsia, for example, or preeclampsia, it's recommended to, or gestational diabetes that's uncontrolled. It's recommended to birth your baby in the hospital for medical care. So there are a lot of things, like birth is an amazing process, and birth is something that your body does. It knows how to do, but we are here because it is not always uncomplicated for everyone. And so sometimes moms and birthing people need a little more assistance. They need a little more care.
Mm-hmm. Now, during the home births, well, Tiana Paris recently gave birth at home, and she shared it on social media.
Okay.
I
Wait,
was like, oh my gosh,
who is Tiana Paris?
what? Dr. House? She's an actress, okay?
What is she in?
See, now you're putting me on the spot. She was in we'll come back. Hold on.
Here, how about this? I talked about Summer Walker.
Okay.
She had a
Who
home
is
birth.
Summer Walker? Just joking.
I was ready.
She
I'm like,
is.
girls just but anyway. So Summer Walker had a home birth with twins. And I want to say, I think she posted this maybe in like January on social media as well. I'm gonna have to Google Tiana Paris and look her up.
She was in, like, I want to say Watchmen, but that's not right. She was. Now we're gonna have a whole thing about this. There's like different things she's been in. I don't believe this.
We're gonna post this and people are gonna be like,
Iraq.
who Tiana Paris is? Is it Parish? Parish.
Paris. Like Parris.
Oh, Paris. Yeah. Okay.
She's very small. I saw her in real life once. In Atlanta, she's there. I think she was in Watchmen, but she's been in, like, I'm gonna take some time to figure it out. Iraq is one though that's the one thing I can think of. You can watch it on Amazon Prime.
Okay.
But she had a home birth too. I think it was just
Okay.
a single baby. And
Okay.
was her first baby. I think she's like in her mid-30s. Um,
Okay.
but she was in a pool of water. Is
Mm.
that typical?
It's something that you can do.
Okay.
Hmm.
If you're not
You
in a
can
pool,
birth
like,
however you want.
oh, so like if you're at home, interesting. So it's not necessarily like always in a body of water.
No, it doesn't have to be. You could birth your baby in your bed if you wanted to.
How did Summer Walker do it?
I don't know if she I'm trying to think. I don't remember seeing in the pictures. It was like after and before, at least from what I saw. So I don't know what she posted and I don't follow her. Um, but you can do it at home in water if you want to.
Oh, okay.
I mean, birth is very different for different people. Like when you think of your ideal birth experience, right? What do you imagine it to be?
I imagine like a dimly lit room,
Mm-hmm.
some smooth R&B, and
Mm-hmm.
like a really great, doctor that is of color and it's a woman.
Mm-hmm.
And I just have a really supportive staff. And my
Mm-hmm.
husband is there, and my mom.
Mm-hmm. Mm-hmm.
I think that's
And
it.
see, in your mind, you have this, and some people, people all have different ideas. Like I imagine something similar. I wanted an oil diffuser with some sense of lemongrass or lavender, and I wanted Renaissance
Hmm.
playing in the background. I imagined being in the hospital
Yeah.
for my birth. I never imagined a birthing center or a home birth. But not to say if like I didn't know more and I didn't have my history, then perhaps I
Mhm.
would have imagined somewhere different. But people have just like people imagine their wedding, people have very kind of concrete ideas about what they imagine their birthing experience to be like. And for some people that involves a water birth. For some people,
Just
no.
like in
But
the
yeah.
bed.
It's just like in a bed. Yeah.
Wow.
Or, people give birth standing or squatting, people do
Yeah.
different things.
I
Mhm.
remember a long time ago, and I don't really watch the Kardashians. I think maybe like their first two seasons I watched, but Courtney Kardashian, like I think for one of her children, like stood and like almost like helped to pull the baby out.
Mhm.
And they were saying that that was like one of the easier ways to do it rather than like laying back and pushing
Mhm.
away. So I thought that was interesting. It does not really, I don't think she was at home. I think she was in a hospital, but I guess that you're right, where you can essentially choose to give birth. I mean, we should be able to choose how we want to give birth.
Sure, it's your body, it's your baby.
Yeah. I never thought about it. I'm always just thinking like
Yeah.
hospital, that's your only option. So
But it's not.
it's not. And I think educating and just like having the knowledge to know that there are other options for you, I mean, could be life changing.
It is. That's part of empowering
Mhm.
is presenting options, providing education, and then being able to make an informed decision that is the best for you and your health and your baby's health.
Definitely, definitely. So I want to know, what are some ways that we can, like, if someone chooses to have a home birth and they think that's the best option for them, what are some ways that they can ensure that they have a safe and healthy home birth?
Sure. So first, I would recommend that they really do a lot of research. Just from researching, am I the right candidate for this? Having a conversation with their doctor or their midwife about, am I the right candidate for this? Also, research your home birth team. It is recommended that you have, if you're going to do a home birth, that you have a certified midwife. Not all midwives are certified. You want to make sure that you have somebody who has the knowledge, background, and then the experience. So ideally, you want to make sure that they've had a certain number of midwives. A midwife, a certain number of home births under their belt as the primary birthing assistant. And one place I was reading in my research for our conversation, they said ideally 100. I don't know how true that is. And I think that was more of an opinion from this particular organization's standpoint, and not necessarily a study show that if you have at least 100,
Mhm.
um, so do your research so you can pick the appropriate team. If you have already, you're seeing a midwife, they don't do home births, they can probably help direct you towards a place to look for people who can assist you with home birth. Um, and I would say start there. And as you go through that process, they will guide you. Find a doula that you like, that is experienced as well, that can also support you in the process. In my podcast with Dr. Williams, who is the OBGYN I spoke with about home birth, she said her doula was the one that was like, okay, based on your birthing experience that you desire, it sounds like you might want to consider a home birth. That was her doula that brought that up as an option for her. So once you kind of get connected with the right people, they can kind of help you along the way with finding the safest options for you.
Interesting. Okay. One of the things that kind of, freaks me out about home births and just thinking about it is you never know what's going to happen during the birthing process. And,
Mm-hmm.
they say, if you're not a good candidate if you have X, Y, and Z, but what if you just, during the birthing process, something happens and you just didn't know that that was going to happen to you? I guess, is it the same thing where you would just be transported to an emergency room if something were to happen like that? Or how does that typically work with your support team?
Sure, that's a great question. So that's part of when you are planning for a home birth. There are 4 things that you want to do. 1, make sure that you're the appropriate candidate, like we said. But 2, you want to make sure that you have expert availability. So the ability the access to and access to consultation. So that's actually 2 and 3: expert availability and access to consultation. You want to make sure that you have available to you immediately a certified nurse midwife, right? That should be who's at home with you. A certified midwife, or midwife whose education and licensure actually meet the International Confederation of Midwives global standards for midwifery. You want to have immediate access to a physician who practices obstetrics in a integrated and regulated healthcare system. Like, these are the words of ACOG that I'm stating for what they recommend if you're planning a home birth. And you want to have access to safe and timely transport to a nearby hospital. So all of these things will help in the situation that you're mentioning, because a lot of times, things happen that we don't expect or don't intend to happen. The majority of births are fine and uncomplicated, but in the event that something like this happens, you want to be able to get the help you need immediately.
Man, okay. Lots of research to do. Now, if
Yeah.
people, want to find more answers and do some of their research, do you have any recommended resources that they can look at?
Sure. So there are communities of doulas and midwives. And when you get in the community, you'll find a lot of access to these resources. ACOG has a whole committee opinion. If you just Google like ACOG, ACOG, for American College of Obstetricians and Gynecologists, um, ACOG home birth, with the whole statement that includes the information that I reviewed. And I know if you I don't have specific resources. If you do a search, you will find them. They are readily available to you. And ideally, you want to look for kind of larger groups and not like specific, like this person's blog, because you want to make sure, or if you do, just make sure that there are references so that you can go and kind of search back and make sure you can find the document that has the information, like the statistics or the recommendations.
Got it. So the conclusion is do your research, make an informed decision. My goodness.
Yeah, and let me give some statistics, because
Okay.
I had this prepared for you. Like, most home births are going to be fine, right? And even in the hospital, most of the deliveries are fine. But in OBGYN, when it's bad, it's bad. You know,
Okay.
when it's good, it's good. It's
Yeah.
beautiful, it's amazing. But when it's bad, and it can go bad quickly, and it can be quite awful. So when compared to planned hospital births, recent observational studies have shown that home births are associated with fewer maternal interventions. So that's things like labor induction, labor augmentation. Labor induction is we give you something or do something to get you into labor. Labor augmentation is you're in labor, but maybe your labor slows a little bit, and we give or do something to speed up your labor or assist with your labor. So it's associated with less cases of those, less regional anesthesia, that's analgesia, that's epidural, spinal, less electronic fetal heart rate monitoring, less episiotomy, which most people, episiotomy is not generally a large part of practice anymore.
Well, what is
Less
that?
operative vaginal delivery and less cesarean delivery, and fewer perineal lacerations. So that's the other tears that, the episiotomy is the tear that we make as clinicians, but the other tears are perineal tears are just the tears that you do on your own.
Mm-hmm.
And then with that said, even though there are fewer maternal interventions, the risk actually increases for the baby. So there is a more than twofold increased risk of perinatal death. That's 1 to 2 in 1,000. So that doesn't seem like a lot. You're like, oh, 1 or 2 babies in 1,000, but that's a lot.
Mm-hmm.
That, especially if that's your baby. And a threefold increased risk of neonatal seizures or serious neurologic dysfunction. So that's like 0.4 to 0.6. So still like a low number, but of course, again, it's not low if it's your baby. So these are just things to keep in mind, that it's all a risk assessment. Pregnancy is a risk assessment. It's all a risk assessment.
I am so scared. Yeah.
Don't be scared. Birth happens every day. And much of birth, your body just does it. So it's not, I don't want to scare you, because birth is beautiful. It's amazing. And most births are uncomplicated and fine.
Mhm. Wow. Okay. Well, research to do. But it's good to know that you have options, and it's good to know that those
Yes.
things out there and people to help like you, and a good support system to calm down those nerves.
Yeah, I mean, it's all about conversation. And regardless, even if you research and you're like, I'm not a great candidate for this, it's still good to be able to just have conversations. You should always feel like that in your healthcare, that you can speak with someone who's an expert, who can provide the options and just kind of help guide you down the path that's best for you.
Yeah. I One last question for you. When you were mentioning the epidural, which is obviously a big thing that happens in the hospital,
Hmm.
you always see that. It is a home birth all natural? It is.
Hmm.
Yeah.
Well, the midwives can carry some medications, but yeah, like you're not going to get an epidural.
Wow.
No,
Yeah. That's
no. And let me tell you, as someone who accidentally had an unmedicated birth with my last baby, it's an experience. It is an experience,
beautiful.
which some people want.
That's true. Yeah. So it's yeah, all personal choice. Wow.
Yeah, it's your choice.
Gosh. Okay.
If
Yeah.
you want an epidural, you got to go to the hospital.
Yeah, definitely. Okay. Well, a lot of things to look at. I appreciate you.
You're like Googling birth control now.
Not for me. Never mind. No, I think it's a beautiful thing, and I enjoyed this conversation. Always enjoy talking to you, and I appreciate you
Likewise.
walking us through this and letting us understand, like, have these conversations with your doctor and your doula, midwife, everyone before
Yeah, you
making
need
your
a team.
yes.
Team. Hmm.
I've got a lot of
Because
work.
look, your doula might think of something that your midwife doesn't think of, who might think of something that your doctor doesn't think of, who might think of something that your doula doesn't think of. We all have different expertise. We all have different roles. And yes, there's some overlap, but we all have different roles. And so you need a team.
Wow.
And not to say you don't have to have a doula. Like most people do not have doulas, but doulas are an incredible support
Mhm.
resource, and anybody can be a doula. If you have a best friend that's willing to come and support you and be there for you for the process, like your friend can be your doula. But it's like having a team is a beautiful thing.
Yes. Okay. Well, thank you for
You're welcome.
informing us.
You're welcome. And I will give one plug. So originally the Lady Parts Doctor was just a podcast, but I've expanded it actually to
Yes.
a women's health platform. So I
Hmm.
do workshops, I do speaking engagements. It's like, yeah, because these conversations need to be ongoing.
Yeah. Well, let me know when you're like doing speaking engagements and,
Sure. I have a
yeah,
big one coming up that I can't really talk about, but I'll
okay.
let you know when I
Please let
can.
me know and how we can support you. I'd love to. Let me know. Yeah. Thank you so much, Dr.
You're
Hunt.
welcome.
See you next time.
All right.